How is IBD treated? Types of common medications to treat IBD. 5-aminosalicylic acids, for people with mild to moderate IBD. 5 ACEs are more effective for ulcerative colitis, but occasionally they may be prescribed for someone with Crohn's disease. These medications reduce inflammation in the lining of the intestines, relieving abdominal pain, diarrhea, and other symptoms. 5 ACEs may help achieve and keep IBD in remission. Doctors may recommend taking them daily as part of a long-term treatment plan. Immunomodulators. Immunomodulator medications suppress or regulate certain aspects of the immune system, counteracting the body's abnormal response to food and bacteria in the digestive tract. They can alleviate symptoms and sometimes achieve remission by decreasing intestinal inflammation. Doctors may prescribe these medications for long-term use in people with mild to moderate IBD. 3. Corticosteroids. Corticosteroid medications are powerful anti-inflammatory agents and are often used short-term to relieve symptoms quickly. They are also helpful when used as a bridge to long-term treatment, since some IBD medications are more effective if they are used after symptoms are under control. 4. Biologics. Biologic therapies, sometimes called biologics, are a class of medications that reduce intestinal inflammation by targeting specific immune system responses. There are 2 classes of biologic agents used to control symptoms of IBD: anti-TNF agents and anti-integrin medications. These medications are often given long-term, sometimes along with immunomodulators. 4. Anti-TNF medications, which block proteins that cause inflammation in the digestive tract. If IBD is moderate to severe at the time of diagnosis or if symptoms have not responded to other medical treatments, anti-TNFs may also be given if symptoms such as a fistula, a hole that forms between the intestines and another organ, present an immediate risk to patient's health. 4. Anti-integrin therapy may be prescribed for people with severe IBD whose symptoms have not responded to other medications. This therapy prevents inflammation causing white blood cells, called lymphocytes, from binding to the lining of the gastrointestinal tract. 5. Conjunctive medications. Medication that is not intended to address the cause of IBD. Instead, it may be used to resolve complications, relieve pain, or address a nutritional deficiency. Antibiotics. If a bacterial infection occurs as a complication of IBD, the doctor may prescribe antibiotics, antispasmodic agents, for abdominal pain that does not respond to other IBD medications. Gastroenterologists may recommend a prescription antispasmodic medication, which suppresses muscle spasms in the bowel, easing pain and discomfort. Pain relievers. If IBD medications don't relieve discomfort, the doctor may recommend an over-the-counter pain reliever, such as acetaminophen. Doctors do not recommend over-the-counter or prescription non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen, naproxen, and aspirin. This is because NSAIDs may increase the risk of stomach ulcers and gastrointestinal bleeding. Vitamin and mineral supplements. People with IBD often have vitamin or mineral deficiencies because digestive dysfunction prevents the body from absorbing important nutrients. These include iron, folate, vitamin D, and vitamin B12. Surgeries to remove damaged portions of the gastrointestinal tract. 1. Small bowel resection. The complications of Crohn's disease result in the need for surgical intervention. Complications include an abscess, a perforation, a fistula, or an obstruction. During the small bowel resection, a surgeon removes the damaged part of the small intestine. Often, this surgery is done using the laparoscopic technique. 2. Intestinal strictureplasty. If Crohn's disease causes a buildup of scar tissue that blocks part of the intestinal tract, doctors may recommend intestinal strictureplasty to widen the area and restore bowel function. 3. Colectomy and proctocolectomy. Colectomy is a procedure to remove part or all of the large intestine, or colon, If inflammation has damaged the rectum, a surgeon may remove it as well, a procedure called proctocolectomy. 4. Ileopouch anal anastomosis. If the colon and rectum have been removed, the surgeon may need to perform an additional procedure to help the body process waste. For people with ulcerative colitis, this procedure is called an ileopouch anal anastomosis, also called J-pouch surgery. For those with Crohn's disease, a surgeon may perform an ileostomy. To perform J-pouch surgery, a surgeon uses part of the small intestine to construct an internal pouch that remains permanently within the abdomen. This pouch mimics the function of the rectum by providing a place for waste to collect and allows people to pass waste through the anus. This procedure avoids the need for a permanent ileostomy. 5. Ileostomy. Because Crohn's disease affects the small intestine, an ileopouch would be vulnerable to becoming infected or diseased. Surgeons perform an ileostomy instead. In this procedure, the surgeon creates an opening in your abdomen, called a stoma. The end of the small intestine, called the ileum, is attached to the stoma. This allows stool to exit your intestine through the opening.